How can this be?
We've got quite a number of patients that come to our clinic, and we sit there, and it's a very thorough evaluation. And I think that's one of the things that people are amazed is that in this day of modern medicine, that someone will actually take the time to sit down with them one-on-one and just go over every aspect of their medical history, what's led them up to the point that they feel like they have to go to see a doctor about their knees. I mean, it's simple things as squatting down, bending over, playing with your grandkids. And you go to the doctor and they just jam a steroid shot in there or something that doesn't work, and then they just pat you on the way because, short of doing a knee replacement, what other option is there? I mean, that's really been the base treatment for as long as I've been doing this. I've been in the medical field for 28 years as a nurse practitioner since 2015 and opened my own clinic this year. And it has just absolutely been amazing what happens to people when you provide them with top quality care, because it's so much more than just the knees. I mean, along with people that have osteoarthritis, they usually have hypertension, diabetes, obesity. They've got all these other long-term chronic health issues. And if they go see an orthopedic surgeon, all that orthopedic surgeon sees is their kneecap. Well, your knee looks good, out of here, let's put a steroid shot in there. When you're ready to have your knee replaced, come back to me. It's amazing how many patients tell me, oh, they told me I need to have my knees replaced, but I'm too young.
Yeah.
Well, what do you do when your knee's worn out and you're 45, and they're saying wait 20 to 25 years before you get that first replacement? And that is a real problem, because it's not the first replacement that's the problem. It's the second and third replacement that's the problem. Mm-hmm. So they wait till you're 65 to 70 before they replace that first knee, in hopes that you'll never need the second knee replaced.
And to be right up front, there are types of knee pain that you cannot treat.
Absolutely.
Okay. What are the initial signs? If somebody is listening to this, and let's say they're just getting back from the golf course, because that strikes close to home for me, and they're just I can't walk the course like I used to. What are we looking for? What are the signs?
I would say most of the signs that people come to me is they usually have one knee that's worse than the other. It's usually maybe they played sports, maybe they had surgery, maybe they had an injury, and so they've been favoring their bad knee and they've been wearing out their good knee. So usually most folks come to me because now their good knee is now hurting, and now they got two bad knees, and now they can't get up. They can't squat, just simple things as the first time when you get up out of bed in the morning to make that first trip, you put your feet on the floor, and it takes a good 15, 20, 30 minutes for your knees to feel like they get lubed up enough to get going. If you squat down and then that pushing back up, I have one of my patients stock shelves, and she can no longer stock the bottom shelves. She has to let the young folks do it. So she can only stock the middle shelves and the top shelves. So it's affecting her ability to do her job. Simple items as walking in and out, going in and out of, going up and down stairs. Some people have pain going up, some people have pain going down, and it's so bad they have to take it one step at a time, going either direction. I even had a patient the other day, they had to take the stairs going backwards. The only way they could get down the stairs was to go backwards one step at a time because they had so much pain. Other people, something simple as going up a wheelchair ramp. They're not able to even the incline of the sidewalk. So they essentially are trapped to everywhere they go has to have an elevator or a flat entrance. So that affects, I've got a gentleman who likes to fish, and he likes to fish off the dock. And of course the dock's rocking back and forth, and his knees got so bad he couldn't even stand on the dock because it hurt so bad. We did some PRP, we did some stem cells. He came back in for a 6-week follow-up, and when he came in, he had a cane. When he came back, he didn't even have a limp. He was completely back to playing golf. He was back to fishing off the dock. His life had resumed back to normal activity, whereas before, it was becoming less restrictive. So that's a lot of my patients when they come in is both knees are now worn out. But my theory is, if you've got one bad knee, let's get that one bad knee tuned up before your good knee becomes your bad knee.
Is it ever too early to come in and have you look at a patient, someone who thinks I may be in the very early stages of knee problems?
Essentially, if you're having knee pain, it's never too young for us to take a look at it. There's a lot of athletes that have sports injuries, teenagers, young people who are running, jogging, playing. They're pivoting and twisting on the basketball court. They're suffering knee injuries. And, the old usual ER treatment, having worked in the ER before, is they'll give you ibuprofen, they'll pack it in ice, and they'll put an ice wrap around it and say stay off of it. Well, ironically enough, long-term use of NSAIDs, ibuprofen, Tordac, diclofenac, all these medicines have long-term side effects, and they actually accelerate the destruction of your knee. And they speed up osteoarthritis. Because essentially osteoarthritis is the juice that's in your knee, that synovial fluid is thick. And when you has a unique physical property, when you put pressure on it, it turns thicker. So as you go through life, every time you take a step, your knee's juice is liquid thick at the exact instant that you need it. And your cartilage regenerates at the same rate that you wear it down. So that's why you can live for 15, 20, 30, 40 years without knee pain. But with osteoarthritis sets in, that fluid becomes thin like water. And when it's thin like water, it can't lubricate the joint. And now that knee cartilage wears down faster than you can regenerate it. Think of it like take a yellow number 2 pencil with the eraser. And if you erase and erase and erase down till you get the metal, what happens to the paper when the metal hits the paper? It cuts the paper. Now, if we could take another eraser cap, and put over top of the pencil, regrow the cartilage, you're good to go. So essentially, we're able to regenerate the cartilage, which then gets rid of the knee pain.
Fascinating. Fascinating. Russell Clark is with us from the Clark Family Practice. So how long does a typical treatment take? I mean, I've been mentioning that this is a very simple in-office, outpatient type of procedure. I'm just curious what kind of time we'd be looking at.
The initial eval, depending on how complex your medical history is, can take anywhere from about 35, maybe 50 minutes, just depends on all the different, every single patient's different. The actual procedure itself is essentially painless. We freeze the skin, we go through the frozen skin, we then introduce a little bit of lidocaine so that the joint is, the area that the needle is at is completely numb. And then we do the procedure. It takes no more than 5 to 10 minutes from start to finish. From the time you walk in the clinic, you greet us, till the time that we've got you ready to go. You can resume normal activity as soon as the procedure is over. So there's no special requirements. Some patients feel like they need to ice their knee down that night, but that's completely optional. But you're able to resume full activity.
Fascinating. So if someone sets up a consultation and you say, yeah, you're a candidate, this is something we can help you with, would they need to reschedule to come in, or is it something that you could handle at the same time?
Actually, we're able to handle it on the same visit. So when they come in, we do all the evaluation. If it's something that they, if they have a problem that we can fix, and that's part of the evaluation is, I mean, we're not magicians. We can't fix everything that comes in our clinic, but there is a wide variety of patients that we are in fact able to help. And those patients, if they decide that they want to do the PRP, the platelet-rich plasma, which I haven't talked much about, we discuss more here in a moment, but the PRP procedure takes about 20-25 minutes. It's very simple. If you've ever had a real bad cut and you hold pressure on that cut till it stops bleeding, those platelets are attracted to that wound. You then went to the emergency room, they sutured it, they stapled it, they glued it, whatever it did to get the wound to not be open. For the next 3 days, it really hurt bad. I mean, that you can't believe you cut yourself that bad. The stitches, they hurt. About 10 to 14 days later, you go back to the doctor. They take out the sutures, they take out the staples. Now the skin is mostly healed. It's still a little bit tender, but it's a lot better than it was. Yeah. About 3 weeks out, the skin is now mostly healed, maybe slightly tender. 6 weeks out, the skin is now almost completely healed, maybe barely tender. And by 6 months, it's just scar tissue. So with the platelets attract the cytokines and the growth factors and the stem cells to heal that wound. So all we do is we draw your blood, we spin it down, and we concentrate the platelets and plasma out of your blood, and we introduce that to the inside of your knee. As far as your body is concerned, a massive knee injury has occurred. So it starts sending cytokines and growth factors and stem cells to repair that damage. So we fool the body's ability to heal itself by concentrating the platelets in one location inside of your knee. And then the platelets direct all that healing activity. Takes about at least 6 weeks. And the way we do our injection, it has 100% guarantee to work. 100% guarantee to work. If you're still having knee pain in 6 weeks, we repeat that injection at no additional cost. We have an entire Knee Regen X35 program that we put together. It's based upon hundreds of research papers, thousands of hours of research, years of training to get to where I am doing this. In fact, I'm a trainer. The company that I do this with, I've flown around the country and trained people how to do these procedures. And I've got people that come to our office and we train them how to do these procedures. So Nashville is sort of the hub for this program. And we're able to go in there with this platelet-rich plasma. We can then offer them stem cells or products derived from stem cells. The products derived from stem cells are extra cytokines and growth factors and all the stuff your body needs to heal. So we'll say a professional football player gets hurt on Sunday. Let's say they have a massive ACL injury, they injure their knee, they're carted off the field. Used to be, I remember years ago, that was a career-ending injury. I mean, you'd never see the guy play again, maybe a coach on the sideline, but his professional days were over. Now, 6 weeks later, not only are they back in the game, they're going on to become the MVP. How do you go from a career-ending injury to being an MVP? And these are done through PRP and stem cells. And these treatments have been done to professional athletes at least 10 to 15 years. And so this is something that's not new, it's not faddish, there's rock-hard science behind why these procedures work.
Fascinating. So somebody who's listening who's going, oh, this is a flash in the pan, this is just a way to get me in so that you do have the research and the history and the stats to back it up. That's fascinating.
Everything we do, one of the procedures that we do uses an FDA product that we use. I won't give the brand name on the radio, but it's a hyaluronic acid based product. Over 85 million injections, been around since the 90s. It's the most used hyaluronic injection on planet Earth. It is so inert in the body, it's essentially bioidentical to your knee. So when I put this stuff in your knee can't tell the difference between what it makes and the stuff I put in there. As far as your knee is concerned, it made it. In fact, it's so effective, your body actually starts to mimic the production of this stuff, and it actually helps more than just your knee. It predominantly helps the knee, but it helps the hips, the ankles, the shoulders, all the rest of your joints. And it's not even technically a medication. It's actually considered an injectable medical device. So we're actually able to go in there and fill your knee full of this stuff. And every week, it's just like a hydraulic jack. We go in there, we put a little bit of the stuff in, and it jacks up the cartilage a little bit. And we do that 5 times in a row. Just like if you put braces on, if you did all the adjustments in 1 week, it'd be too painful. So every so often they go in there and twist them and twist them and twist them. So each week we go in there and we put some more of this hyaluronic acid in there, and we're able to fill that joint full of that space. Almost all insurances cover it. I can't say 100%, but we've only had one insurance out of the past 9 months that I've been doing this that was a flat refusal, that it was a plan exclusion. Yeah. Every single other insurance, especially Medicare, this is the preferred procedure that they want these procedures done because it's cheaper to have non-surgical knee injections than it is to have surgery knee replacement. And there are patients that come to me that are no longer surgical candidates. Their size no longer permits them. The doctor says, well, if you lose 100 pounds, come back to me. And if you could lose 100 pounds, they would have already lost 100 pounds. So now their knees are shot. They're no longer a candidate for surgery. And, they're using walkers and canes. And eventually they're going to be wheelchair bound if we don't do something to help them.
Wow. Fascinating. And I'm glad you touched on the insurance. I was going to ask about that. So let's put somebody in touch with you. What are the best ways to set up the consultation, the free appointment?
The easiest way to reach me is we've set up a website called stemcellguy.com, STEMCELLGUI, stemcellguy.com. Or you can call our main office at 615-988-1109. The quickest, easiest way is going through the website because you can actually look at the information, look at all our testimonials, and you can even set your own appointment. If you call the phone number, it's after hours or on the weekends, you may get an answering service, and they'll take your information, and we'll get back with you. But either stemcellguy.com or 615-988-1109.
It's exciting. It's fascinating. It really is. I can't tell you. And when actually we talked about the number of folks that I know personally who have gone through either single or double knee replacement surgery, and it's just the cost, the recovery, the pain that's involved there to have an option, an alternative. That is fascinating. Thank you for coming in.
And the one thing about the knee replacements is 75% of the people that have knee replacements have post-replacement pain. And with our PRP injections, we're able to minimize their post-surgery knee pain.
So until someone who has had knee replacement, if they come in, you can assist them as well.
Exactly. We've got several patients that we've done PRP. We can take care of sciatica pain, the nerve coming down out of the back, going down into the leg. We've had multiple patients that we've gotten them completely off of their pain medicines through PRP injections. So when you're able to concentrate the body's healing power, we're able to focus it on whatever part of your body that needs to be healed.
Wow. That is just fascinating. Russell Clark from the Clark Family Practice. Thank you for coming in.
I appreciate it. Thank you very much, Mike.
I appreciate it very much. Answered a lot of my questions as well. Again, 615-988-1109, the phone number.